Hello there, this is Sujata Martin, and today I want to talk about traditional postpartum belly massage. Now, conventional postpartum care today is so different from the traditional practices in a lot of cultures around the world. From traditional postpartum practices in India, which I'm very familiar with, to those seen in China, the Arab countries, North Africa, traditional Native American cultures, and South American cultures. A lot of these share a common theme of nurturing the mother. Yes, babies are so important, newborns are so important and need so much care, but for the well-being of the baby, the mother needs to be happy and healthy, and for that we need to take care of the mother physically and emotionally. A very common physical well-being or care practice in these postpartum traditions is massaging the mother, and today we are going to focus on postpartum belly massage. All you need is a clean firm surface to lay on. You can do this massage on yourself as a newly postpartum mother, or you can have someone do it to you. Usually it is a traditional postpartum care provider. In India it's often called Daima. Of course, in the Western world that would translate as a postpartum doula. So maybe your doula can help you with this, maybe it can be your partner or even your older kids. Make it a fun activity for them to, do some fun things with mom. So I hope this video is helpful. If you had a vaginal birth with no complications, you should be able to follow these techniques from day 3 or 5 based on how you are feeling. If you did have a cesarean birth, please get clearance from your surgeon. Make sure your stitches are healed before doing these massage techniques, because there will be a lot of movement of your skin and underlying tissue, including your abdominal muscles, and we don't want to disrupt anything that your provider has done. So keep watching. I hope these techniques are helpful. Use oil or lotion that helps your skin move easily against your hands, and I hope you well-being and good healing. Thank you. Talk to you soon.
We are going to start with straight strokes coming in from your side towards the midline. When performing on someone else, use hand placement as demonstrated in the video. If massaging yourself, for your right side, you will be using the cupped fingers or your fingers in a hook shape of your left hand and the heel of your right hand, pushing the skin and underlying tissues towards the center. For the other side, we will be reversing hand placement, meaning for your left side, you will be using your right cupped fingers and the heel of your left hand, gently moving skin and the tissues underneath in towards your midline. This targets your rectus muscles. Next, we move to a circular massage with hand placement being under the ribs on one side and on the opposite hips on the other. Right now, we have our one hand under the left-sided rib and on the right-sided hip, moving in a counterclockwise direction. After a few strokes in this counterclockwise manner, we will soon be switching our hands to the opposite position, with one hand placed under the right-sided ribs and the other being on the left hip, moving in a clockwise direction. This helps stretch our obliques and the fascia over the obliques to their pre-pregnancy length, helping them come together in the midline, which also contributes to helping heal a diastasis. Following this, we do our last stroke, which is an upward massage starting over the pubic mound, up and in towards the umbilicus. This helps encourage the upward movement of the pelvic organs in the postpartum phase. This mother has a cesarean scar, which is why we spend a little extra time massaging and moving that scar out. This has been left out for the privacy of the person who is receiving this treatment. Continue the upward massage from one hip towards the other in a U shape over the lower abdomen and the pelvis. This is easily done on yourself. We hope you loved this tutorial. Be well, save these techniques, practice, and share. Tell your friends about it and return here for more good pelvic health info. Goodbye.